one, imagine having a busy day at work and your cell phone just seems to go off every second and every minute of the day. Is answering to every text message or call ethical? Of course it's not. In fact, it causes many issues. Many people are accessing their phones in the workplace for different reasons, such as family emergencies or just to play Candy Crush to make the time go by faster. Today, I will discuss with you the benefits and problems we as CNAs face when we are accessing our phone on the floor. Family emergencies are one of the main reasons why we access our phone on the floor. When you have small children, it gives us a sense of comfortability to know that our children are okay and they are safe. And of course, we would like for other family members to get in touch with us too. Anything can happen, such as getting really sick or small accidents. According to Don Rosenberg McKay, almost any boss will be understanding about answering a call when there is a family emergency. People like to get in touch with you immediately, especially when they are dealing with your children. And going through second parties could be a hassle because sometimes companies don't answer their phones because people are being transferred to people that have stepped out of their office, or the nurses aren't able to answer the phones because they are really busy and they only like to answer the phones for the doctors. There are many ways to go about answering your phones, or responding to a text message, such as stepping off the floor of the building, or stepping out of the building period. Accessing your phone on the floor shows you do not care and it makes you look unprofessional. Appearing unprofessional in any work setting causes many problems, but especially in the healthcare setting. People will start to question whether you are there for the patients or you are just there to have a job. Unprofessionalism and having your phone out makes the patients feel uncomfortable. Besides, you will be breaking the HIPAA law because you are in a private setting and no one knows exactly what you are doing on your phone. When you break the rules, the rules, you tend to get write-ups, then suspensions, and eventually it leads to termination. According to Don McKay, don't bury your nose in your phone. Keep your head up. Family members may get offended because they don't know if you're recording or taking pictures of the patients. A simple response to a text message calls you your job. It is important to stay focused and aware when you are dealing with confused patients, fall risk patients, and family members. Any distractions or lack of attention is just an accident waiting to happen, even to employees. I remember walking down the hall and I had my face buried in my phone and I tripped over a wet floor sign. Due to me tripping over this wet floor sign, I hurt myself really bad, which caused my employer to call the ambulance, and I had to do an employee evaluation, which caused them to spend money on a drug test. You could be sitting right across from a patient and take your eyes off them for a couple of seconds and something can happen right then and there, such as a fatal fall. According to Pretender and Ashwani, findings from existing work illustrate that smartphones are a significant source of distraction for decision-based activities such as driving, classroom work, leaving, and classroom learning and work-related tasks. Distraction causes bad quality care, which can cause more medical issues for patients. Say for instance, you're in a room with a patient performing patient care on a patient who is incontinent, and you get a text or a phone call from someone, and then you start to rush your work because you want to reply to this text message or answer this phone call. Technically, you are giving bad quality care because you have rushed your work and you didn't take care of the patient properly. Also, if you are pulling out your phone while you have your gloves on, it is unsanitary because it causes the risk of infections for yourself and also the patient. Responding to work-related text messages or emails may be another good excuse to access your phone when working. Emails and texts from your boss could be important instructions for dealing with the patient. Picking up extra shift by responding to a text is also an advantage, especially if it is first come, first served. Cell phones are being used for multiple reasons, but unfortunately they are causing many problems. Appearing unprofessional and being distracted is the last thing you want to do in a healthcare setting. You should not be able to access your phone because it is unethical. You will break rules and perform bad quality care. Your customer service skills will be poor and patients won't be taken care of to your full ability. And there will be no good teamwork. Cell phones cause issues. They should already be placed in lockers, but due to disrespect, employees won't listen. So I think that they should be taken away when you are beginning your shift.